Yeah. So welcome, Amrita. Please introduce yourself. What I know of you, you have been working for so many years. I still remember the transgender summit which happened in Kolkata so many years back, and you were still at the forefront and raising such important issues. And when I look at people like you, Amrita, I really feel that the governments, if governments had listened to you and done what communities were asking them to do, we would have been on a different position in the HIV response. We could have done so much better. We have done better, we have done good, but like we could have done way better if communities were leading. So over to
Mm.
you. Please introduce yourself and welcome.
Okay. Thank you so much, Bobby. It's a great pleasure to meet you after a long time, as you have said. Yeah. So I am Amrita Sarkar. Currently, I work for India HIV Alliance. So we work mainly for HIV/AIDS and other related areas. And our main beneficiaries are people living with HIV, uh, people who use drugs and in PWID community, then definitely transgender people, uh, women in sex work, we also call them female sex workers, ASSW. So these are some like these beneficiaries. We have multiple programs developed for them going across all over the country. The main project is currently is Bihan, supported by Global Fund, where we are having like care and support center. And now this is a new phase. It's called Project Samagra. So some of the care and support center has actually taken up by the government now. So the next phase will be to the rest of the PhDs. Those also have to be taken up by the government. Apart from that, we have other important projects like there's a project for the transgender people. I mean, in a dedicated way, it's called Project Sahat. That's happening in 9 states of India, supported by Agim Kendri Philanthropic Initiative. So that also talks about not only the HIV, but their overall health perspective, their social well-being, connecting them with the National Transgender Portal. And then the project I am associated with is the National Prevention Project happening by Frontline since last couple of years, where we have like partners organizations who are the national level partners working for the different key populations like NCPI, IDUF, NNPP, then Infocell, AINSW, NNSW, and NIPASA. So there are total 7 networks working for different key population groups, and through this project actually we try to bring the community and the stakeholders, including NAPO, including UN body, at the single platform to have face-to-face conversation in terms of discussion on achievements and also gaps in the HIV prevention mechanism and how community can respond better. If we talk about that country's effective HIV AIDS prevention mechanism, how community can take part into it. So that's in a nutshell about my current job. Yeah.
Yeah, thank you so much, Amrita. Amrita, you are one of the lucky people to be there at the world's largest AIDS conference this year, the 25th International AIDS Conference, or AIDS 2024 in Munich, Germany. Thanks to people like you that the theme of the conference was put people first. This is something which you have been saying for so many long. So I was very happy to see that the theme of the conference is so relevant. Now, since the conference is a bit, it's like 2 3 weeks ago when it ended. So when you look back, like what were the top highlights from your point of view? If you are to share with us, like what are the top few highlights? What are the top issues which you would like to talk about from the AIDS 2024? Over to you.
Right. As you have correctly pointed out that it's putting people first, so community was given the high priority. And as you know, before the main conference, there were like 3 conferences as well, dedicated for different com communities, right? So I can remember that there was a session on cervical cancer. So yeah. So can I continue? Hello? Yes. So can I continue? I cannot hear you.
Yes, please continue. There was a bell
Okay.
actually, so it's okay.
Okay.
Yeah.
Okay. So I was talking about the pre-conference and it's now going beyond the typically HIV focused intervention. For example, there was a session on cervical cancer and our CE, like Minister Rajiv Dua, he actually attended that session and gave his thoughts and I mean we had a case presentation there represented by our PE, Mr. Rajiv Dua. So that session was very important since we also forget sometimes that cervical cancer is equally important not for the cisgender people but also people who are into risky, behavior or unsafe sex and all, including female sex workers, young women, and if I talk about transgender people as well. And then if I talk about other types of cancer, that are also, we try to highlight if we talk about anal cancer, right? So that is quite prevalent in MSM groups. So now I think the things are shifting. Yes, HIV/AIDS is a primary focus. There's a objective that we have to finish it by 2030. But now people are trying to give it a holistic approach. I mean, yes, HIV/AIDS is important, but what are the other areas we can integrate? For example, even if I talk about NCDs, other non-communicable diseases, if I talk about cervical cancer, definitely the one other area I have seen that came in many presentation sessions that is mental health. So this is actually very, very much important area. Often we forget to highlight this area even within the HIV sector. As you know, people who belong to key population groups, people who are affected or even impacted by HIV, that's a huge area of like to think about to invest more on this. And the other part is, as you know, this is era of AI, artificial intelligence. So now people are turning more into virtual intervention. Even we have a virtual intervention called Project Matrix that is supported by Global Fund, where we try to reach actually the unreached group who are mainly available through the social networking sites, dating apps, and it's very difficult to track their behaviors or promote the HIV testing treatment and all. So I think these are some areas that actually I can think of, and definitely I have also seen example of implementation of PrEP. PrEP is rolling out in many countries. If I talk about Malaysia, I think it's they are giving it free. In our country, as we know that there are a couple of organizations who try to do some kind of a study or pilot project. But if we talk about implementation at a larger scale, that is still not happening, right? And there are many problems in terms of its cost, in terms of proper SOP and all. Though we know that NACO is working on it, I think there is a PrEP guideline now that is there. But the thing is, the point is the implementation, the rollout part now, because it's quite costly. And if I talk about LGBTQ community, people who are sex workers, people who inject drugs, it's very difficult for them to buy online PrEP all the time. And it's also important to provide them proper information. Why is it important? What are the basic do's and don'ts, or if this can be, like ART drugs, if it can be, made like free of cost, that will be very, very much useful in a country like India. So I think these are some areas that I can still think of. Yeah.
Yeah, thank you so much, Amrita. Really, it was so good for me to listen to you because I was not there. So, what a learning. And thanks a lot for mentioning cervical cancer. I remember, I think it was 2018, like it was just one part of a small session. So, it's good that Rajiv and you people could really put more spotlight on that. And I'm also was very proud. I was watching it virtually with the pre-conference on key populations. This is the first time in the history of AIDS conference there was a pre-conference on key population. Imagine, like like that should have been the plenary or always have been in focus. But chalo,
No.
at
A
least
small,
now, yeah,
a small correction. Actually, I don't think this is for the first time because I am also associated with a global network. It's called IRGP, International Reference Group of Trans Women and HIV. And we started the pre-conference for the trans population in 2016. 2016, Durban. So we are organized this actually, and then now this time it is being organized. This trans conference is organized by GRIP, Global Action for Trans Equality. But in Amsterdam, in Durban, we organized that, and we co-organized it last time as well in 2022 in Canada, Montreal. So I think pre-conference is very important because sometimes we see that all the typical like technical sessions, scientific sessions, maybe all the key population groups cannot participate, right? So this key event, this key conference actually helps that to address that gap, where people from different countries, online, offline, grassroots level community people, they get the opportunity to join. Then that's a very very much community led process. That's why that more participatory way, and then people can talk more about their problem areas, gap areas. They can share their experience, learning, everything. So pre-conference is definitely good. And I think you also know that there is very happening is event or like happens. It's a global village, right? So in global village, there are different networking zones. Networking zone for the LGBTIQ people, networking zone for the trans people, networking zone for the sex workers. So that is another area where they have continuous discussion, they, forums sometimes film screening, sometimes maybe kind of like panel. I have been part of one or two panels this time in Global Village itself. I also screened a film in Global uh, Village that we made during the COVID era and how like key populations got affected during COVID. So that uh, film also I got the opportunity to screen. Uh, Apart from that, I had a poster presentation that is on this Stevenson project. So yeah, so I wanted to tell you that apart from defined or like dedicated session on different topics related to HIV, there are other important opportunities if I think about global village, if I think about poster presentation, if I think about stores given by different corporates, including big bodies like Gilead and all, uh, uh, where I got the opportunity to go to their stall to interact with those people, how they are thinking. If you talk about in terms of trade or in terms of any other like ph- pharmaceutical products, what are their plans to bring this for the population. So it's a holistic way actually. Absolutely.
Yeah, totally agree. And a special thanks for reminding all of us and correcting us that there is a long history and long lot of work has gone into making pre-conference on key populations. True from 2016, which is really great, and because it was so
Actually,
important. Thank you.
actually, it happened before that. I actually can remind in 2008, the International Space Conference happened in Mexico. And then I was there and I met first time the chair of this IRGP group, Ms. Joan Kipley. She was heading the Center of Excellence for Transgender Health in San Francisco for a long years. And she then and other of couple of transgender community members, we realized that it's a very less opportunity, very limited opportunity by that point of time. I'm talking about 2008. That like we could see hardly like apart from 4 5 of us, it's not easy to find the transgender people, but they are highly impacted in terms of HIV, children, right? So there we had a meeting with UNAIDS in the conference itself that how you can help us to bring more community people and all. Then we got in touch with, and now it's called Impact. Before that, it was called Global Forum on LSM and HIV. So they actually supported us by that time, and we formed the international network for trans women and HIV. And then slowly we got more representation. Now we are having around 18 or 19 members too across the globe, and there are couple of milestones actually that have been done. through this international platform where we came together. For example, you must have heard about Transit. Transit is a global SOP or guideline to implement how HIV or AIDS program or STI program can be implemented better for the different communities, right? So all the people, all the writers were from the transgender groups only. And I can remember I did a chapter there that was supported by UNFPA. So this is one like a great opportunity, and that brought us through this conference only. Then we had another program. It's called Teach, TEACH, Teach. That is for the translate organization that we implemented in Latin America, in Africa, and in certain countries of Asia that was supported by this healthcare. So through this conference, actually, there the transgender experts, transgender leaders, they came together. They thought about some global advocacy. So I think that is another very important area that we have come across.
Thank you so much, Amrita. You are an institution, a walking encyclopedia when it comes to the HIV response and community leadership. So thank you for sharing all those insights. Amrita, is there you know so much. Like, is there anything when you look back which you learned new at this conference? Please be welcome to share that. Thank you.
Yeah, as I was mentioning you, I think new thing is that though it's not absolutely new, but the thing is that I can see an era is coming where we can see, we'll be able to see more virtual bits in everything. And like there are several apps now, and that I think is getting implemented in many countries, and that is actually helpful to reach to the unreached people who are not like typically addressed to existing targeted intervention program or HIV program. So I think this is the area. And other new things, I have seen that now it's a time of integration of services along with HIV services. So HIV TB is already there. Now I can see our task is coming to integrate cervical cancer, to integrate NTB, to integrate mental health. I think these are the good areas that we can think about. How the HIV program can be more holistic, way can be developed with a community-centric approach. See, actually, HIV is treatment, testing, and everything. If I think about India, yes, we have pre-testing, we have pre-ARV and all those stuff, right? But if you see the very basic example, if I talk about transgender people, right? So most of them actually go for gender affirming care, hormone replacement care, therapy, and all those stuff, right? And those are actually equally important to integrate with HIV services. Because you can well imagine if a person is living with HIV and cancer and also wants to go for the gender affirming care, surgeries and all, extra medical care has to be given, right? So how we can do that? Definitely we have to integrate all those sa- services. And also I'd like to tell you, I also send you the link. I think it was 2022. Yes, NAPO, National AIDS Control Organization, published a white paper on comprehensive health care for the transgender people. I was also part of that process. So I think these are the areas. Definitely now the time is that how we can better serve the community, better think about the community with their other needs which are not getting addressed at every platform. How interview program can be more holistic, more community centric, integrating all other digital healthcare needs. Yeah.
Yeah. Thanks a lot, Amrita. Again, so Amrita, like, you have already mentioned so many things, and also the work of such important work of which Alliance has been doing, and you have been also involved with that. So, are there any more take-home messages or learnings which you think will which you are thinking that it could be, it could either be integrated, Alliance can, or other
Yes,
networks can help take it forward. So, can please share some
absolutely.
of those?
Absolutely. I think the takeaway message is that if you are working for a particular community, think about their holistic needs, think about their overall well-being, think about their other basic needs. If I talk about education, if I talk about healthcare, if I talk about livelihood, uh, because I have a long experience of 24 years working nationally, globally, and grassroots level people. And like I worked in rural Odisha for so many times when I was in Sati. There I have seen that transgender people, if I give one example, I mean, when I started to work for them, they actually make me surprised. They told me that we know about condom, we know about sepsis, but we want to know how you can give us income, how you can give us education. Then only my test behavior, all these things will be work better. So that actually helped us to think from a different way. We got a project from American Youth for Service, and there we provided income donation support, non-formal education support and all. And one day came actually when I visited them, a trans woman, I came to know that she slapped one of her like clients who came to her to have sex. I asked why you slapped him. So she was saying that he was forcing me to have sex without condom. And now I can, tell him, and I told him that now I am associated with many meaningful work. Now I am not dependent only on sex work. I am saying not saying that sex work or all these things is bad, but the thing is that we have to provide options, right? So because he had some other work, education opportunities, income generation program support and all those things. So she became more confident that now she do not have to engage herself in uh, unsafe sex. So I think these are the areas we have to think from a different way that communities who are marginalized on basis of a gender or people who use drugs, people who are in sex work, they are already marginalized and HIV is, gives another layer of stigma, discrimination. So I think we have to think beyond that, even being in the HIV sector, how we can think about the more holistic way, think about their mental health, think about their overall well-being. We don't have to not necessarily run all these projects, but at least you can integrate them, link them, you can give proper referral. I think those also will bring a lot more impact.
Yeah, so true, absolutely. And what you are saying about integrated health, holistic approach, exactly these are the things which were also echoed by communities in the Thailand. I was reading about that, and exactly these components of mental health and others, like they've been calling, and so rightly so, and so rightly so. And let us hope that this happens sooner than later, and as soon as possible. So it's all about people, it's all about human beings, and let us hope that this care remains goes integrated in a holistic manner. So Amrita, sorry to take you so much of your time, but it was really insightful. Any closing
Thank you.
thoughts, any thoughts which you would like to share with us in relation to the HIV response after the conference? Anything
Yes,
to
yes, absolutely. I think now the different countries, their governments, big donor agencies, they are realizing now. That's why they keep this theme that put people first. So now I think it's a high time to involve community from the planning part to implementation part, monitoring part. When we talk about community-led monitoring process, we have about think about CSS, community system strengthening part. I think these are the areas actually we have to think that to strengthen the capacity to build the capacity of the community so they can lead their project, they can more meaningfully contribute to the cause. I think uh, that is one part, and I think for the donors, for the stakeholders, my request is that these people who are LGBTIQ or sex workers groups or PWID people living with HIV, they are already marginalized, having so many problems. So I think now we are requesting to you, yes, within the healthcare program, within the HIV program, allow us to bring other aspects. For example, if we talk about mental health, if we talk about non-communicable health diseases, if we talk about gender affirming care for the transgender people, cervical cancer, I mean, for instance. So I think allow us to integrate all these services to have more research. If we talk about PrEP, I think we all pray that yes, PrEP should be available in India in coming days. So I think these are starting for technology coming in. Yeah.
Yeah, thank you so much, Amrita, again for your time, for sharing your insights. Really good to talk to you. Personally, a very happy moment for me to connect with you again.
No
So,
problem.
so
Anytime.
really good to see you too. And I am in Delhi, so we will definitely probably meet
Yes.
at some point soon
Yes.
too. So, so thanks
Yes.
a lot. Have a great day, and thanks
You
again
too.
for.
Have a great day, and it's very nice moment that I have got connected with you after a long time. They definitely we can think about more collaboration and all the best for your good work. Thank you
Thank,
so much.
thank you, Amrita. Thank you.
Okay.
Take care.
Bye.